How to prevent a stroke caused by a brain aneurysm. Have you ever suddenly found yourself wondering, could there be a serious health condition silently developing inside your body? One that shows no warning signs, no pain, no clear symptoms, just waiting to strike when you least expect it? That fear isn't far-fetched. In fact, there are dangerous diseases that can quietly progress day by day inside us, without any noticeable signals. And by the time we finally recognize them, it might already be too late. Today, I'd like to take you through one of the most important topics that many people are concerned about, and one of the questions I get asked the most from patients and their families. How can we detect and prevent strokes and brain aneurysms early? These are two extremely serious medical conditions that can take away your ability to move, speak, remember, or even take your life in just a matter of minutes. What's truly alarming is that both of these conditions, strokes and brain aneurysms, can quietly develop over many years. No pain, no obvious symptoms, nothing to warn us until the day a major stroke happens or an aneurysm ruptures and causes bleeding in the brain. That's why understanding them, identifying the risk factors, and having a plan for early screening and prevention are absolutely essential. And to begin, we need to ask, what exactly is a stroke? Put simply, a stroke happens when blood flow to a part of the brain is suddenly cut off, meaning the brain cells in that area don't get the oxygen and nutrients they need. Without blood supply for just a few minutes, brain cells begin to die. This causes serious damage to whatever part of the body that section of the brain controls, whether it's movement, speech, vision, memory, or even emotions. There are two main types of strokes we should all be aware of. One, ischemic stroke. This is when a blood vessel supplying the brain becomes blocked, often by a clot. Think of it like a plumbing blockage. 2. Hemorrhagic stroke. This occurs when a blood vessel in the brain ruptures or bursts, causing bleeding into or around the brain tissue. There's also something called a transient ischemic attack, or TIA, sometimes referred to as a mini-stroke. This means a temporary blockage occurs, causing stroke-like symptoms, but the blockage resolves itself and blood flow is restored. While temporary, a TIA is a major warning sign. Now, many strokes, especially those caused by blockages in our blood vessels, develop slowly over many years. For instance, uncontrolled high blood pressure or unmanaged diabetes, along with inflammatory factors like smoking, can damage the lining of our blood vessels over time, leading to blockages.
In the case of a hemorrhagic stroke or a ruptured blood vessel, this is also often the result of a long-term process. Chronic, uncontrolled high blood pressure and other underlying conditions can cause our blood vessel walls to harden and weaken, a process called atherosclerosis. Eventually, this can lead to a rupture. One particularly dangerous type of hemorrhagic stroke is caused by a ruptured brain aneurysm. Imagine a weak spot on the inner tube of a tire that starts to bulge out. That's similar to an aneurysm. A part of an artery in the brain balloons out. This thinned, bulging wall is fragile and can easily rupture, like an overinflated balloon, especially if there's a sudden increase in pressure. When it bursts, blood spills into the space surrounding the brain, often called a subarachnoid hemorrhage. This is a very serious event that can affect the entire brain, leading to coma, paralysis, and often death. Aneurysms often develop at the branching points of arteries in our brain because these junctions can be inherently weaker. Over time, the constant pressure of blood flow can cause these areas to bulge. Statistics from the US indicate that a significant number of people may have an unruptured brain aneurysm. Some figures suggest as many as 1 in 50 people, or around 6 to 7 million individuals in the US, with women being affected more often than men. What's crucial to understand is that most of these unruptured aneurysms don't cause any symptoms and may never rupture. However, if an aneurysm does rupture, or if someone is having a stroke, the symptoms can be sudden and severe. Beyond the typical stroke symptoms like weakness or paralysis, a ruptured aneurysm might cause blurred vision or even complete vision loss, sudden weakness on one side of the body, a dilated pupil in one eye, an excruciating, unbearable headache. If you or anyone you know experiences these symptoms, call 911 immediately. Time is critical. So, the big question is, how can we prevent this? The American Heart Association and American Stroke Association have clear recommendations. All of us have some risk of stroke, and this risk generally increases as we get older. The recommendations focus on managing chronic diseases and encouraging healthy habits. Here's what you need to focus on. First, understand your risk. Do you have high risk or low risk? Knowing this will motivate you to make stronger lifestyle changes. Consult your doctor regularly. The American Stroke Association has risk assessment tools that your doctor can use, considering factors like your blood pressure, whether you have diabetes, or if you smoke. Knowing your risk empowers you to protect yourself. Second, healthy eating. Adopt a balanced diet, rich in fresh fruits, vegetables, fiber, and healthy fats. I have other videos on nutrition you can check out to understand how crucial a balanced diet is for overall health.
Third, regular physical activity. This is paramount. The American Heart Association recommends at least 150 minutes of moderate intensity exercise per week. That's about 30 minutes, 5 times a week. Or, if you prefer vigorous activity, aim for 75 minutes spread throughout the week. This could be brisk walking, running, playing sports, anything that gets your heart rate up and makes you breathe harder. Fourth, maintain a healthy weight. Being overweight or obese is a significant risk factor for stroke and many other diseases. The US, unfortunately, has a high prevalence of obesity, and this trend is seen globally. Fifth, don't smoke and avoid secondhand smoke. Smoking is a major risk factor for stroke. This includes passive smoking. If you live with a smoker, you are still at increased risk. Sixth, control chronic conditions. This is absolutely vital. High blood pressure, get it checked regularly and take medication if prescribed. Diabetes, manage your blood sugar levels effectively. High cholesterol, work with your doctor to control it. Gout, manage this condition as well. All these conditions can damage your blood vessels, making them prone to blockages or rupture. It's crucial to see your doctor and take any prescribed medications exactly as directed. Don't stop or change your medication dosage without consulting your doctor, even if you feel better or your numbers improve. Seventh, be proactive in your healthcare. Instead of waiting until you have a problem, actively engage in your health. Watch educational videos like this, understand your body, and talk with your doctor about your concerns. Ask, I want to understand my stroke risk. What can I do? Now, what about screening? Some people ask if they should get an ultrasound of their carotid arteries, the main arteries in your neck that supply blood to the brain, to check for blockages. While this can be done, the current guidelines from the American Heart Association do not typically recommend routine carotid ultrasound screening for stroke prevention in people without symptoms. What about screening for brain aneurysms using imaging like CT scans or MRIs? The recommendation is that imaging to look for an aneurysm is generally considered only for individuals with a strong family history, such as having 2 or more first-degree relatives, parents, siblings, children, who have had a brain aneurysm, a personal history of a subarachnoid hemorrhage, a ruptured aneurysm, or certain genetic conditions that predispose to aneurysms like Ehlers-Danlos syndrome or polycystic kidney disease. If you don't have these specific high-risk factors, routine screening for aneurysms is generally not advised, as most unruptured aneurysms don't cause symptoms and may not ever pose a threat. Stroke is one of the most silent and deadly threats we face. It doesn't care about your age, gender, or status. It can strike when a blood vessel in the brain gets blocked, or worse, when it suddenly ruptures. And when it does, the damage can be irreversible: paralysis, coma, or even instant death. Among all types, a ruptured brain aneurysm is one of the most severe forms of stroke, and it often hits without warning. What's truly alarming is that many of the causes behind it build slowly and quietly over the years: uncontrolled high blood pressure, diabetes, smoking, obesity, and a sedentary lifestyle. But this is not a death sentence. We can prevent strokes, starting with small daily actions: eating a healthy, balanced diet, moving your body regularly, maintaining a healthy weight,
And above all, managing chronic conditions like high blood pressure, diabetes, and high cholesterol. If this video helped you better understand how to protect your brain and prevent stroke, please give it a thumbs up, subscribe to the channel, and share it with someone you love, because this knowledge could truly save a life. And I want to hear from you. What's one small thing you'll do this week to don't stay silent? Don't wait. Start today. I'll see you in the next video. Stay healthy, stay informed, and take charge of your life.